I'm Sarah,
And I'm Jen.
and this is our patient Tim. So we've already went through and have done our subjective exam.
And we have found that he has some lateral ankle pain when doing after exercise, and then numbness and tingling every once in a while.
Okay, so first we're going to start with doing the Ottawa rule for fractures, just to rule anything out. Okay, I'm going to have you take your shoe and sock off for me. Okay, so I'm just going to palpate a little bit and let me know if you feel any pain or anything, okay?
Okay.
All right. Here, there. And when you had first injured your ankle, were you able to place weight on it right away? I know it was kind of
No.
This was a while ago, the injury.
Yes.
Okay, so now you're fine. Okay, so I'm going to rule out a fracture. Don't have any issues with palpation at those spots. We'll have you put your sock and shoe back on. And then we're going to start with analyzing your posture and some gait movements. So some walking with your shoes on and then with them off. Okay. So I'll have you just kind of walk back and forth to me and back to the wall. One more time.
Okay, and now we'll have you take your shoes off. Both of them.
And your socks.
Okay, and now we'll have you walk again. One more time. Good. Now we'll have you stand right here, and we're getting your natural stance, and we're going to assess your posture. He's a little more, has more toes on his right foot. So he's a little more Charlie version.
I think I'm going to side plane.
This is arch. Toes are coming. He's got some muscle bulge. So it's a little bigger.
Okay. Okay. So we maybe see a couple things that we want to look at. So we're going to do some more tests to take a look at those things, and we'll let you know what we think. Alrighty. So first we're going to start with a test kind of with your arches, and I'm going to get on the ground and measure the distance from a bone in your foot to the ground, and then we'll do both sides. I'm going to start with your good side here. So what you're going to do is stand shoulder width apart, and this is your bad leg, so you're going to kind of shift all your weight to that side. Okay. And now just kind of relax a little bit, stand in your normal. Okay, awesome. All right, now I'm going to do the other side. So I'm going to have you put all your weight on this foot. Okay, and now just stand and relax, normal. So both sides with those were about the same. So now we're gonna have you sit on the table. Alright, so normally I would sit on the ground, so I have better body mechanics. Okay. Now I'm going to do a test for some impingement and some structures in your ankle right here. So I'm just going to apply some pressure while I'm moving through a little bit of a motion, okay? Let me know if you feel any pain, okay? You have anything with that? You have anything with that?
Okay, so next we are going to do another test to see if there's any excessive motion in this part of your foot. I'm going to start with your good leg. And I'm just going to have you rest naturally. And I'm going to move your foot out. Okay, tell me if you have any pain. Okay, now this leg. Okay. All right. And next, Sarah is going to measure how much, if you have any swelling around your ankle.
Okay, so I'm going to have you lay on your back, head on the pillow right here. Okay. I'm going to wrap this tape measure around your ankle a couple times and take some measurements, okay? I'm going to do the same thing on this side. Alrighty, we don't see much difference, but just a little more swelling seen on this side, just by off that centimeter there.
Okay, so next I'm going to test your, you can continue to lay down and relax. And I'm going to test to make sure you're feeling everything. When I squeeze the top of your foot together, if it produces any pain, please let me know. Good. Okay. Numbness or tingling? Okay.
Alrighty, now we're going to do some dermatome testing. So this is just going to kind of test the nerves. This won't hurt you. And so I'm just going to kind of touch on some spots on your foot. And I'm going to ask you if it feels the same for each foot. So I'll do one foot, then the next, and I'll see if it's the same, okay? Alright, just relax and close your eyes if you want to. Okay. How does that feel? The same, different?
Same.
Okay. Okay. Same? Okay. Okay, you can keep laying back on your back until we tell you to move. Okay, now I'm going to do some resisted motion testing to test kind of the strength of the muscles and to see if it reproduces any pain when I do these motions, okay?
Okay.
So I'm going to kind of push and I'll tell you not to let me push you down to the side or something like that, okay? So first, don't let me push you down. Okay, don't let me push push your foot out. Alright, good. And then don't let me push your foot in. Did you have any pain with those? Same with this one. Don't let me push your foot down. Okay. Don't let me push your foot up. Don't let me pull it out. And don't let me push it in. Any pain there? Okay.
Okay, so next I'm going to see if you have any excessive motion throughout this part of your foot. I use this test. Okay. Now for your back foot. Okay, we have a lot more motion on that one, so we will take that into consideration. And next, I'm going to have you flip on your stomach, please. I'm going to test the motion in your foot to see how much and how little that you have in two different ways. So I'm going to have you. Okay, and then either. And just hold it there. Okay, and then we're going to do your other foot. Gonna go through this motion. Good. Nice and slow. Can you hold it there? Okay, I'm gonna do that again. Hold you. Okay, and one more time. Good. Now I'm going to test inversion, or the other way your foot moves. Okay. Can you hold it there? $35. Can you hold it there? $35. Again. $34. And one last time. Good.
Okay, so now we're gonna do a little bit of joint play with the movement at your ankle. So I'm just gonna kind of see how they move. Start over here. I'm gonna have you lift this leg up for me right here feel? Good. Okay, you can relax this. I noticed left foot had a little more movement than the right one did.
Okay, and the last thing we're going to do is put you in a neutral position and look to see how your foot is aligned. So just move your foot. Okay, we are all done, and we will get an assessment to you soon.
Thank you.